Ty, we've talked about some natural therapies for cancer. Does it matter what kind of cancer you have? Does that depend on, does that change what therapy you'll go after? Or like you said before, that it's basically an immune system reaction. Do we just look for herbs that maybe can, or supplements that can boost our immune system?
Yeah, good question. Yeah, there are certain types of cancers that are faster growing than
Hmm.
others. There are certain types of herbs that you would want to use that may work quicker. Certain natural cancer treatments that may work quicker than something else. And if you have a faster growing cancer, you would definitely want to look at that. If you have, for instance, if you have a basal cell on your hand that hasn't metastasized, probably not anything to get alarmed about at first. But if you have a melanoma that's spread, then that's something that you would want to use a faster acting. So I guess the quick answer to your question is, yeah, it depends upon the kind of cancer to an extent, but what do all cancers have in common? They're all a result of a compromised immune system. So regardless of the treatment initially, you need to be on an immune boosting protocol so that after you initially take care of the growth of the cancer, that you can get your body back into balance so your immune system will continue to fend off the cancer because we produce cancer cells every day.
Hmm.
So I guess there are similarities to any cancer protocol. I would recommend that every cancer patient get on Life One immediately because Life One's the best immune stimulant, the immune booster that I've ever found in researching. So no matter who the cancer patient is, I always recommend that they get on Life One because one of the reasons they have the cancer is that their immune system failed. And so they need something to get their immune system back up to snuff. And so, but then if you have somebody that, let's say they have a brain tumor that is about to cause their skull to explode or kill them, we won't cause their skull, it'll just kill them, then they may need to, and that's one of the rare instances where you may need radiation. Okay, you may need a surgery to debulk the tumor. Those are rare instances where conventional, because it works fast to take care of the symptom, it could actually be needed with brain cancer. But removing a tumor with surgery, a brain tumor with surgery, won't cause the cancer to ever be healed. It'll just get rid of the symptom, but you still got the problem. But you might need the radiation to shrink it quickly or the surgery to get it to give yourself some room, because another part of cancer treatment that a lot of doctors don't understand is that when you initially, when a cancer is being attacked by your lymphatic system, the tumor will initially swell up before it shrinks. And so when an oncologist immediately looks for shrinking of tumor, he doesn't really understand the way that your lymphocytes are working on the cancer, because when your CD cells and your macrophages infiltrate a tumor, that will cause the tumor to grow bigger initially. And so with a brain cancer, if your tumor's so big that it's already pressing up against your skull, there's no room left, and then you're going to use an immune boosting supplement that causes your lymphocytes to attack that tumor and to kill the tumor, there may not be any room left in your head. So again, that's an instance where you might need surgery or radiation temporarily to shrink it. But that's something that a lot of even oncologists don't understand, is that a tumor should initially get bigger before it shrinks.